All right, good morning, everybody. I hope you are doing fantastic today. We'll give it a few more minutes to let people to kind of filter in, and then we'll be getting started. I don't want to take up too much time as this is an extremely important topic today. Um, Lots of contention and questions and thought-provoking items in this topic as it is vaccines. So we'll be getting started very shortly. Okay, with that, I'd like to go on ahead and get started. I'd like to thank everybody for joining us today. Success Beyond COVID, getting to the new normal. Today we are joined with two fantastic gentlemen. They're going to be talking about COVID vaccine and employer options. And with that, I would like to introduce today's speaker. We have Dr. Kusti. Dr. Kusti is the President and Chief Medical Officer for Optimal Workplace Environmental Wellness Corporation, the Regional Medical Director for Pivot On-Site Innovations. But one thing I found about his background that is very unique is that he has a unique experience with corporate benefits, specifically in healthcare. He also came to us previously from the United States Steel Corporation. So he has this very unique background in being able to understand the corporate health benefits side as well as the healthcare side. So I'm excited to have him. I'm also extremely excited to have Will Bondurant here as well today. What's interesting is not just that he's the Chief Financial Officer of Castlight. The interesting element that he brings to us today is his work over the past year with COVID. Him and Castlight actually worked on the creation of a COVID-19 test center that was powered by Google and Apple Maps, and it empowered patients to find testing sites effectively. I kind of have to giggle at that because nowadays testing, even though it should still be extremely important, is not nearly as highlighted as the vaccines. And with that, more recently, Will collaborated with the CDC and Boston Children's Hospital. Him and the Castlight team helped create a vaccine inventory portal for providers and the National Vaccine Database behind vaccine.gov. So with that, I'd like to go on ahead and give these two gentlemen as much time as possible, and I will turn it over to them. Gentlemen, this is your show.
Thank you so much, Michelle, and good morning. It's great to be here with Espen. It's great to be here virtually. I do look forward to when we can be together again in person. And today's topic will let us do that sooner. Vaccinations are the pathway to that. And so looking forward to spending a little bit of time together talking about the role that employers are playing in vaccinations, and then hearing the wisdom of Dr. Kusti on the vaccine itself, and what is true and what is not true, and how we can all help combat that misinformation and help more people get across that line and get vaccinated. We'll then move into a fireside chat session. I've got a couple of questions for Dr. Kusti that I know I've written down and will want answered myself. And then more importantly, though, we know there's an audience of folks that are listening to us today and look forward to your questions and answering them before we move to a break in the session and continue with the day. So with that, I'll go ahead and jump in. And as Michelle mentioned, I am the Chief Financial Officer at Castlight Health. And you might say, am I here for continuing education on my accounting credentials? And you're not. Over the last year or 18 months, I guess, 15 months, I added a second hat. And that second hat was as one of Castlight's kind of COVID resources for our clients. And so Castlight, as many of you know, is a health navigation company, provides a digital solution and a human solution to help individuals navigate the healthcare system and their health and well-being. Nothing was more important at many points in time over the last year than COVID. And so I've spent most of the last year reading and studying and learning what there is to know about COVID, and then helping facilitate conversations with our clients. So we'll bring some of that in this first section. To start, just to level set context, I think so many of us know and feel the realities of COVID-19 because benefit leaders were on the front lines in some sense, navigating COVID from the beginning in our workforces and in changes that all of us had to make to our teams and to our kind of policies and procedures and the like. And, you know, of course, over the course of the past year, the impact of COVID on our populations and on the country has been massive. More than 32 million cases, serious amount of morbidity and mortality, and also a serious amount of cost, and an amount of kind of accumulation of hospitalizations for our benefit plans. But we also have, in this country at least, and we know we're lucky in that, it's not true everywhere, the light at the end of the tunnel, and that is the vaccine administration. And so as of today, we've administered more than 260 million vaccines. About 1 in 3 Americans are fully vaccinated. More than half of the eligible population has had their first shot. And what we'll talk about today is where we are and where we are going, and specifically the ways employers are choosing to involve themselves and participate, and the places where there are questions. And vaccinations themselves, as you think about how to get people to the vaccination and help answer questions, have become one of the latest in a round of navigation challenges, helping individuals navigate the healthcare system during the COVID-19 pandemic and during the crisis. And the Kaiser Family Foundation, which doesn't have a connection to the Kaiser Hospital system, but is an independent research entity, has been doing a really helpful tracking survey. They're surveying a couple thousand people every month to ask about vaccinations and how people are feeling and what they're dealing with and what's holding them back if they haven't and the like. They've been doing this since last fall. And in their latest data, which is from April, there's some pretty interesting information. The first is that about a quarter of unvaccinated adults, so that's the folks that haven't yet gotten a shot, about half of the adults in this country, still say they don't have enough information about when they can get the vaccine. And that's interesting, of course, because at this point, everybody in the country who is an adult is eligible. And so there's a gap of information there. The second is about a fifth don't have enough information about where they can get the vaccine. And that's a place that I think there's a role for employers to play in helping to navigate and provide information, and I'll answer that. And then the good news on the kind of the other side is that about 2/3 of adults already have gotten the vaccine or say they'll get the vaccine as soon as they can. And so that's the population that we've essentially worked through most of it already, a little bit left to go. And so I'll spend a good bit of time today talking about actually the other third. That's the population that says, I'm waiting and seeing, or I don't plan to get the vaccine. Because ultimately, we want to provide as much information and support and guidance to those populations, because the way out of the pandemic for us and then for our companies, the employees and employees that we represent, is for more people to be vaccinated to help us tamp down on the potential spread of COVID and especially the terrible outcomes, hospitalization and death that can come from COVID. I thought it'd be helpful just to level set a little bit of where we're doing and how we're doing across the country. You can see on the left, this is a map that Bloomberg helpfully pulled together of the percentage of the country vaccinated by state. And you can see that it ranges from the low 30s to the high 40s across the country. And importantly, there are some geographical differences. And I think it's relevant here today. We're talking to folks, all of us are in the Southeast. And the honest to goodness truth is that in the Southeast, vaccinations are lagging. That's been the case since kind of the mid-March timeframe, late March in some states. And so there is a little bit more work to do. And what we see on the right side here is that the reason we're lagging is that the percentage of residents, the number of residents that went in for their first dose peaked earlier in the Southeast than it did in the rest of the country. There are still people who are excited and almost desperate to get the vaccine in California or in Washington or in New York. And there's a lot of availability and a lot of supply right now in other parts of the country, in the upper Midwest, in the Southeast, and in the like. And one of the things that we at Castlight are really proud of is the support that we have done in helping the CDC, Michelle mentioned this briefly earlier, to make it really easy for anybody in the country, not just our clients or people who are covered on Castlight's health and wellbeing solutions, but anyone in the country find a vaccine. And so we have built over the course, well, we built it in the fall and it's been used over the course of the last 5 months, a solution where providers enter their inventory, reporting it to the CDC. We manage that inventory and then are powering a website called vaccines.gov that just launched. It was Vaccine Finder before, that helps individuals find a vaccine in their community and essentially understand where there are vaccines in stock. And if they're looking for a specific vaccine, which at this point, some people who are hesitant say, I'd prefer the single shot. I don't want to go in twice. I'd like the J&J vaccine. Or others say, because I have a young kid, I want to go in with my 16-year-old, or now actually my 14 or 15-year-old, I want the Pfizer vaccine. To find that on vaccines.gov, providing everybody in the country that same resource that we are, of course, providing our customers, a trusted vaccine navigation capability. But what that allows us to do also is to see inventory across the country. And so one of the pieces I mentioned earlier is that we've flipped in the kind of vaccination campaign from the phase where there was more demand than supply, and people were waiting or lining up, or competition for appointments was fierce, to the phase where there is enough supply for essentially anybody who wants the vaccine on any given day. And across the country, we've actually seen, even just in the last week or so, most of the large pharmacy chains go to a walk-in model as opposed to an appointment model, which looks more like the flu shot or other immunizations that you might get in the course of kind of a normal year. And that should help us, because there are some people who said, I'll get the vaccine. And in fact, it was 7% in one study, 11% in another, that said, I'll get the vaccine. I don't want to fight those websites that the state set up. I don't want to fight, figuring out how. I'll wait until it's available. And so we are now at that point. And across the country, you can see more than 45 million doses, unused doses, ready to be delivered, are actually sitting in provider offices, in hospitals, in pharmacies, the locations that vaccines are being given. And then again, importantly for this group, there's a lot of those across the South. And so there is vaccine ready for individuals who are excited and ready and willing to go get their shot, to get their jab, as our British colleagues would say. And like I mentioned just a minute ago, we've worked and are providing, across the entire country, this easy service to find a location to get a vaccine where there is vaccine in stock nearby to where you are. And so it is at vaccines.gov. Couldn't be easier than that. But when you search on vaccines.gov, we did it for this slide in Montgomery, but it's true across the country. You can see where the vaccine's being delivered within a certain radius. You can also see which vaccines they have in stock. And then if you click in, it will show you what the information that you need to know about making an appointment or walking in. And so some sites are still appointment-based, others are walk-in, and so it gives you that information as well. And so if there's one takeaway today, it's that it is easy to find a vaccine at this point, and we know that as employers, we have a role to play in helping our populations know that they can find a vaccine and where to get that, and that in many cases, it's very convenient at this point. And it wasn't 2 weeks ago or 4 weeks ago. So you can forgive folks who didn't know that, but it's very convenient to find that vaccine. We also at Castlight have several hundred employer clients. And because we've been supporting them over the course of the last 15 months with COVID, we are doing monthly surveys on the top concerns, the top areas of interest, and the top areas of focus. And we found in April, the last survey we did, some information that I wanted to share, some of which I don't think is surprising, and others of which have become, I think, to Michelle's point, controversial or places for discussion. The first is that 100% of our clients have said that vaccination in their workforce is a top priority for 2016. That is the case because it allows us to relax safety restrictions. It allows us to do more on our manufacturing lines or in the production facilities or even in the office. And it also will help ultimately protect everybody at the company as more people are vaccinated. But most of our clients are not planning to mandate vaccines, but there's a caveat there. And almost every client is saying, we want to make it as convenient as possible, as easy as possible, and encourage it. And I'll talk about how we're supporting that in just a little bit. At the same time, there's a little bit of concern, and I think this is a place that we can even get into discussion about asking employees to report voluntarily if they've had the vaccine. So if we're not mandating, most clients are saying we're also not currently planning to ask, at least in an identified way. A number of clients have run surveys internally or using the Castlight app, asking the question, and are getting good results, seeing 50, 60, 70% saying I've already got the vaccine or I'm going to take it as soon as possible. And then in terms of safety protocols, the things we all learned very quickly last March and adapted over the course of the year, about 60% plan to discontinue one or most once the majority of their population has been vaccinated. And we'll get into a little bit the opportunity for employers to offer incentives, which can be a carrot, help individuals say, you know what, it is worth getting the vaccine. Some of those are financial. You've probably read about employers offering paid time off or even gift cards or cash, but others are actually around behavior. And so employers are saying when a certain portion of our population is fully vaccinated, we will remove our mask mandates, we will remove some of the social distancing, and we'll make it feel more like it used to in our workplaces and in our work facilities. And one of the things that I want to leave you with, I've got a couple minutes left here, is how you as an employer and as a benefit provider specifically are uniquely positioned to help. And so this data point on the left, I think, is sometimes forgotten by those of us in employee benefits and health and well-being, but employees trust you more than almost anybody else for healthcare information. It's their doctor and their employer. And they don't trust their TPA or their plan as much. They don't trust public health sources as much. There's been a lot of challenge with that over the course of the last 15 months. They don't trust the news as much. They don't trust even their family and friends. And so that's a really special and unique place to be. And of course, we know that employers have historically provided healthcare to a large portion of the US population, and even provided vaccinations, flu vaccines. About a quarter of those or a fifth of those in the country typically in a normal year are administered at work sites. And so what can you do? And what have we been engaged in helping our customers provide, and kind of what have our customers asked of us? It starts with promoting vaccine adoption and providing educational information. So how do you get vaccinated? What are the vaccines? What are some questions and then some information we can provide, some of what Dr. Kuste will highlight in just a little bit, to help address those questions employees might have about the vaccine. The second is promoting broader vaccine adoption by delivering vaccine navigation. And so if you remember the data points at the beginning, about a quarter of people don't know when and about a fifth don't know where. So that's an opportunity for employers who will benefit from their employee workforces being vaccinated and helping communities to provide that information. And so you can see here in the Castlight app, the Castlight navigation experience, what that looks like. a quick little chat tool. Where are you located? Who are you looking to get the vaccine for? And then providing the locations, the vaccines that are available there, and how that individual can access it. There are ways to do that, of course, in your navigation platform, the tools you provide employees like Castlight. There's also ways to do it for those of you that haven't, purchased a solution like that, even just with public resources, vaccines.gov, for example. And when you do that, what we've seen across 2.6 million people who have accessed, there is a lot of interest among employee populations, especially among those high-risk users, those users that are at risk from COVID. Almost everyone has used the tool, but even across everybody who uses the healthcare and the benefits, about a third have engaged with vaccine navigation to find out where they can get a shot. So wrapping it up, what I would leave you with on the employer role in vaccinations is that it is critical for you and for us to help educate our employee workforces, thinking about this in a sensitive, multi-touch educational effort. It's not a single email or a single flyer. It's thinking about different concerns, thinking about different needs, and providing that educational content. It's enhancing our benefits and tailoring our efforts to target specific populations that will either need more support in getting the vaccines. For example, I was talking to a client yesterday with some South Georgia production facilities where it's a little bit more challenging. It's not quite as easy as it might be in Atlanta. And considering incentives to motivate vaccinations. One of the pieces that has come out in a number of research studies over the last couple of weeks is that incentives are really driving behavior. You're seeing states do it. The state of New Jersey is doing a campaign I kind of liked, a shot and a beer. If you get your vaccination, you get a free beer. But a number of employers are also offering incentives from paid time off to get the vaccine to the incentives I mentioned around behavioral modifications that don't actually cost any money, and you might do anyways, but tying them to the community effort. And then finally, empowering employees, giving them the information they need and the tools to cross that line to say, I know where to get the vaccine, I know when to get it, and I'm going to go actually make the time to get it. So with that, I'd like to turn it over to our next section, and Dr. Kusti is here. He is truly an expert in so many things, health and well-being, but comes from a benefits perspective, having been in-house as the chief medical officer as well. And so he's got some information to share around the vaccines themselves and how we can help combat some of the misinformation you might see and hear in the marketplace. So with that, I'll turn it over to you, Dr. Kusti.
Thank you, Will. I appreciate it. Hello, everybody, and thank you for thanks to Aspen to host us today. And I'm looking forward to our discussion. Hopefully, you guys can ask some questions. You can use the Q&A chat box or raise your hand, and then we'll get to your questions. Next slide, please. So before I start talking about the vaccines, I felt this was interesting to share with everybody because this was a survey that was done prior to COVID-19. As you can see, it's a 2019 survey that looked at individuals' misinformation about vaccines in general. Now, a lot of this was targeted for parents and kids, but some of it was for adults as well. And I found it very interesting because I saw an exact similar pattern with the COVID-19 vaccine. So in the survey, about roughly 20% thought that vaccines could cause autism. This is despite the fact that there have been numerous, like hundreds of clinical trials and studies that basically found no causation association between any vaccines and autism. There was that one article that was actually pulled and retracted by the own authors, indicating that that wasn't the correct conclusion. And people still latched onto that, and especially people who are part of the anti-vaccination movements. And they were just telling people, hey, if your child get this vaccine, they're going to get autism. And that is absolutely based on no science. About 15% thought that the vaccines are full of toxins. And I see this a lot with COVID-19. And again, there is no clinical indications and I was going to talk about reactions and side effects and all that, but there's no indication at all that the vaccines have any toxins in them that really cause significant harm to a person. 20% inaccurately thought that there's no difference whether a parent or an adult choose to delay or spread out vaccines. This is, despite current recommendations from the CDC, people are doing that even with and I thought this was relevant because, with the COVID-19 2 shots, we are seeing roughly 5 to 6 million people in the US who opted not to get their second shot, or they wanted to space it more than was recommended. And obviously that's not advisable. And about 20% incorrectly thought that it's better to develop immunity by getting the disease. You all heard this theory about, oh, let's let everybody get infected, open up everything, and let's get herd immunity quickly. That is extremely dangerous and unacceptable in our current date of time. Basically, we're thinking about wiping out a quarter or 1/3 of the human population. That is something that we would not do ethically or morally. And obviously that is not in any way, shape or form, a way to look at how we deal with pandemics and outbreaks. The interesting fact also that the two boxes at the bottom, many who reported low trust in medical authorities also believe of vaccine misinformation. And also this belief in vaccine misinformation was true across all different demographic groups and political beliefs. So it wasn't one region or one political party or any of that. It was all over the scope. Next slide, please. Also, I thought this was an interesting fact. Again, this is from a publication in 2005, but it talks about determinants of vaccine confidence. We can see there's trust, there is attitude and belief, there's healthcare provider confidence, which we saw significant issues with that with the COVID-19, just because when you think about it, not all physicians typically deal with vaccination and immunization all the time. I mean, if you're, like myself, I'm occupational medicine, preventive medicine. So preventive medicine has a lot to do with vaccines, pediatrics, maybe infectious diseases, but there are other specialties that rarely talk about vaccines and don't really have a lot of engagement in looking at the research and what's most up to date. And those were put on the spot, being asked very difficult questions. So it appeared that they weren't confident, and that led to further vaccine hesitancy. And the last one is informational environment. And what I felt was very appropriate here is how the media, the news outlet, and the social media played a role in how vaccine misinformation got around and how people believed what they saw in social media, despite the fact that we wouldn't do this for anything else. I don't suppose somebody would go to social media to check what is the best cancer treatment for them and not follow their oncology recommendation. Same thing with cardiac or diabetes, but yet we saw that unfortunately with COVID-19, despite the fact that this disease kills people just like the other illnesses. Next slide, please. So I wanted to address, there's a lot of misinformation, a lot of myths, but we picked 3 for the sake of the slides. However, if there's any more, we're happy to discuss, but these are like very common ones. So we're going to talk about the vaccine being not safe because they were developed quickly. Again, these are myths, not facts. COVID-19 has a lot of severe side effects, and then the COVID-19 alters your DNA. Next slide, please. So when talking about the first myth, first of all, the current technology that is used for COVID-19 vaccines, whether it's the messenger RNA or the adenovirus vector vaccines, are not really new technology. They may be new to people who are not been in this field observing the new and latest of immunization. But if you recall the first SARS outbreak and the MERS, that's when we started using that about a decade ago, basically utilizing the messenger RNA vaccine technology. And there were clinical trials ongoing. It stopped because the outbreak just ended and it wasn't significant anymore for them to continue the trial, but the technology itself existed about a decade ago. Same thing with the adenovirus vector, that technology that's used for example, the Johnson & Johnson and AstraZeneca. These are not new technology, and therefore we don't believe they were developed quickly. However, we did get better in developing vaccines because of just groundbreaking, breathtaking, scientific advancements, which, for future references, we will get even faster and better in developing vaccines, hopefully. But also add to that significant resources were pooled to developing these vaccines, including removing financial barriers, supporting from the government, and also that competitiveness between organizations, who's going to make the vaccine first, sort of went away, because if you look at the vaccines, almost every vaccine has a collaboration between multiple agencies or multiple scientific groups. So that helped. I mean, if we have the scientists unite against a common disease or common enemy, I think we can do a lot more. And I hope to see more of this kind of action in the future. But having said that, that does not mean that any of the standard safety protocols were bypassed or ignored, and then everything was followed as we normally do with any kind of research. It's just happened a lot faster. The vaccine, as I mentioned, was created with using these technology. The messenger RNA technology allows us to make the vaccines faster than the conventional way, which is why we saw the first one that was approved under the EUA was the messenger RNA vaccines. And then to be considered for approval, the clinicians and pharmaceutical companies that are making this must have followed at least half of the participants in their vaccine trials for at least 2 months after completing the vaccine series. And the vaccine must be proven safe and effective in that population. The reason they picked 60 days or 2 months is historical data from vaccine reactions and side effects throughout the last 30 to 50 years has shown that the most time between the vaccine and a side effect or a reaction that we've documented was 45 days. So we don't see in our history at all that somebody got a vaccine in 2002 and then in 2010 they developed some kind of disease or reaction. That's just not something that we saw in humans. And therefore, 45 days was kind of like the safe cutoff, but they added additional days to it just to be sure. So that's where we ended up with the 60 days. Next slide, please. So the second myth or misinformation is that the vaccines have severe side effects. And, we right now reached 1.32 billion doses worldwide. And, these vaccines are heavily monitored, as you can imagine. Every single reaction, every single side effect is reported. And so far, what's been published is that there are some short-term, mild to moderate vaccine reactions. They typically and most commonly resolve within the first 1 to 2 days or 48 hours. There have been reports of severe effects, as you saw probably with the blood clots. But again, that did happen within about 7 to 14 days of vaccination, in some rare situations with 3 weeks. But having said that, those were looked at and investigated heavily and were shown to be extremely rare, to the point where they weren't sure if it's more in the general public, who just an incident in the general public versus people who are getting the vaccine. And also early phase studies from the Pfizer-BioNTech vaccine did show that 50% of people will develop short-lived symptoms at the site of injection. This could be like soreness at the site of injection. Also some systemic reaction, as you can see here, headaches, chills, fatigue, muscle pain, fever that lasts again for 1 to 2 days. There are again concerns about people not getting the second dose because of the fear of having severe side effects. And we strongly recommend that you complete your vaccine series. If your vaccine requires a second dose, that you really should consider, and we strongly recommend that you take the vaccine for multiple reasons. First of all, to have the full effectiveness and the protection of the vaccine, you need to take the 2 doses. Second thing is, with the new variants, their studies are showing that vaccines are effective against new variants only when completing the full series. You have to take the second dose for it to be effective. And then, just to keep in mind that even if you develop these kind of immune responses and your systemic response, these are good indications that your body's responding to the vaccine. Now, that doesn't mean that people who don't get a severe one are not developing any reactions. It's just people are different and they develop immunity over different time periods, depending on your immune system, your medication, your genetics, your background. So, but it's typically one of those things in medicine when, we look at it and like, oh, that's a good thing. It looks like you had a good reaction. That means you're probably going to have good protection from this vaccine. Next slide, please. Now, this myth is, I keep hearing a lot that COVID-19 vaccines will alter the DNA, will go and alter our genetic codes. And I think this is a very important one to talk about, because for people who are not in the genetic fields or in the biology fields, hearing DNA and RNA, it sounds very similar. It could resonate with a lot of people and they could believe it. So I think it's worth mentioning here. But the vaccines that have the messenger RNA, like the Pfizer and Moderna vaccines, they basically allows your own cells, by giving them, the vaccine is the recipe to make the spike protein of the virus. So it goes into the cell, your cell makes the protein, send it out, and then messenger RNA vaccine degrades immediately. From what we know about human cell biology, messenger RNAs coming from outside the cell cannot cross into the nucleus where our DNA cells. If you look at the picture on the right side, you can see that purple or dark blue sphere that says nucleus, and then inside there is where our DNA lives. Around the nucleus, we have something called the nucleus membrane, and that is a really, really strong barrier, because our bodies do not want anything to go in and alter our DNA. And what the viruses themselves do, when they infect the cells, they hijack the cell and they embed their own genetic material in our DNA, and then causing the virus to replicate and make more copies of itself. But then the cell immediately triggers a self-destruct signal, which kills the cell. Obviously, if we have a vaccine that crosses to the DNA and alters our genetics, and then the cell dies, it would not be an effective vaccine at all. In fact, it would be a deadly virus. So again, just talking about simple cell biology, messenger RNAs typically do not go into the nucleus, do not cross the nucleus membrane, and cannot alter our DNA. Next slide, please. So with that, I think we can start our fireside chat.
Thanks, Dr. Kusti. That was very helpful for me when I heard it, and it's been useful in conversations I've had with our clients. And so I appreciate your insight, and I appreciate kind of the contribution. So for the folks on the line, I've learned how to use Zoom over the last year. If you want to type in a Q&A, a question, I've got that open. And so we will be able to hit any questions you might have. But in the absence or until that happens, I've got a couple of questions, and I think we can have a conversation back and forth with ourselves. And so just actually coming out of your section, Dr. Kusti, I realized we've read a lot and heard a lot about changes in vaccine hesitancy over the last couple of months. And I'm kind of curious how you've seen the concerns or the questions that you're getting or that your clients are getting change. What are new questions, and maybe what was put to bed? What are people feeling better about?
Well, I think the main thing that pops up right now is, with return to office planning, a lot of employers and clients of mine have their employees concerned about having them return to office because they're thinking, well, what if I'm vaccinated and I go back to work and I have people that are not vaccinated? How safe am I? And I think this is one of the newer discussion topics that is coming up, and we're trying to educate people on how to deal with that. There's obviously a concern. What we've been advising people is that, first of all, if you mentioned it earlier, employers should encourage their employees to get vaccinated by providing them accurate information from a reliable resource to help them make an informed decision. We do know that there are people that are unable to get the vaccine. They have a medical contraindication. There are people that the vaccines simply just don't work on them. We know studies are showing that people with organ transplant surgeries, they take certain medications that prohibits their immune system from developing a reaction. So there are people that are going to be there that have legitimate concerns. And for those, employers have been or will be offering flexibility by offering, like, if these employees self-disclose that they are voluntary, self-disclose that they are high risk, then they would have a discussion about a reasonable accommodation, and they may continue working from home until we get to a certain level or percentage of vaccination in the community that would make them feel comfortable. We also encourage them to have these discussions with their main specialist and healthcare provider. But we also advise people that if you are returning to work and you know that your workforce or coworkers are kind of half and half, or like it's a mix and you don't know who's vaccinated or not, you're probably safer to continue with the guidelines and practice that we've always done, like physical distancing, facial coverage, advanced personal hygiene, like hand washing for 20 minutes, water, soap, or hand sanitization, staying home if you're sick, and staying away from people who appear sick. These are very simple things that you can do that really makes a huge difference in mitigating your risk of getting COVID. So this was an interesting topic that came up recently.
Yeah, it's been an interesting one that a number of our clients that I've spoken with over the course of the past couple of weeks are dealing with. Many or most have had large portions of their workforce working over the past year in production facilities, manufacturing, retail, whatever it is, but now have already brought back or are planning to bring back their corporate workforces or their office workforces. And in our world, they have asks for us. Can you communicate? Can you provide information? Can you help ensure that we're doing it safely, but also effectively? And it's been kind of a second or a third challenge. And I'm curious also. One of the questions that I've heard a lot from employers is concern about variance, and to some degree there are a number of variants. It seems some are more concerning than others, but I'd love to hear just maybe the 60-second view on what employers should be thinking about as it relates to variance, and where it should change approaches or policies, and maybe where where the fact that variants exist shouldn't.
Yeah, that's a good question. Well, so one thing we should understand that political decisions by government to relax restrictions are not always based on science. So we know that the variants are in fact more transmissible, meaning that they can be easily transmitted from one person to another, particularly the four main ones: the UK variant, the Brazilian, the South African, and the new one, the Indian one. And these variants, when you have a virus that we know that it's more easily transmissible, I don't think relaxation of restrictions is appropriate from a public health intervention standpoint. So employers can educate people and say, hey, I understand your frustration. You don't want to wear a face mask or a face coverage at work, but we know that these variants are out there and they're very common and they're more easily transmitted. So maybe even though the city or the local authority said, you don't need to wear masks, maybe you do that yourself as an extra precaution. Another thing we need to make people understand that the only way to stop these variants is to get the vaccine. The variants come out because they are allowed to replicate. So when the virus is allowed to replicate in our cells, it experiments, it changes its genetic codes constantly to try to make itself better. It's a survival instinct, just like any other living organism, which viruses are living organisms. So if the virus is not being fought immediately by your own immune system, it's just going to experiment and more variants are going to develop. Now, a strong incentive for people to get vaccinated is that, remember, if we don't stop the variants from or virus from self-experimenting by getting vaccinated, we might end up having a super variant that is not, our vaccinations are not going to be effective against, or our current treatment will not be effective against. And that will only prolong this pandemic, in which we all want this pandemic to be done. Now, remember, for the vaccines to be effective against the variant, you have to complete the full vaccination series. That is what the science is showing us.
Yeah, thank you. And it's so true. That is such a powerful motivator. And we've seen it with our customers and with people across the country. For us to end the pandemic, it is about vaccinations. And it's a powerful incentive. All of us want to get back to even more of what we want to do. We have a couple of questions that have come in. I'll just use first names. But we've got one from Randy, one from Abby. So we'll start with the one from Randy. So some parts of the country have been open, have had fewer public health orders or restrictions, while others are just starting to reopen. We've seen the difference among, Northern California and then states in the South, just to draw distinctions. How can employers speed up their return to work efforts in light of other experiences and the lack of trust that we mentioned is the question from Randy.
Well, again, I think providing the opportunity for employees to discuss their concerns. I mean, I know it could be difficult, but hearing them, I'm doing a lot of live Q&A webinars, very similar to this with employers. So these companies are my client and we have global operations. So we're actually doing different time zones. But we are just inviting everybody to come and ask questions. Let them ask questions. They can submit it through email. They can submit it through chat. They can do it live. And that was the first thing we've recommended for everybody. Just hear what the employees are saying. What is their concern so we can address them appropriately. The second thing is, as an employer, you want to make sure that your work site is safe. So you want to, and tell people what you've done. Like, you have hand sanitization everywhere. You have good air circulation. You programmed your HVAC system to dilute the air, to have more outside air mixed with the indoor air. And you've managed, for example, a lot of employers are bringing people in different percentages. So they're only bringing 25 or one fourth or 1/3 of the workforce at a time, and then staggering different start time and end time, and bringing in different groups at different times, still managing the business, but during different times, so that you don't have a lot of a cluster of people at one time, during this, to avoid any potential. If somebody gets COVID, then you don't have to shut down completely. You're just going to have to isolate that one small group. And then again, provide education about the virus, how it gets transmitted, about the vaccines. And that seems to be what most employers are doing right now. And again, we want to eliminate all barriers to getting the vaccine. So a lot of the clients are either providing incentives through points in their benefits, they're giving money in their HSA account, or the most common one is that they give them paid time off, basically not from their regular PTO and not from their sick leave, to get the vaccine. So, and maybe take 1 or 2 days off if they develop any reactions. So they're not counting that against them. They're just allowing it as part of the COVID time period that they've had before.
And one of the things, Randy, I'd add is, Castlight supports clients that have national workforces. Therefore, they are tailoring on a state or county level. And so using the platforms that you have available to you and other clients have to continue tailoring, because it will be different in different locations and geographies. The next question, and I'll leave it open. I think we could do one more after this until 5 till. But from Abby, what are recommendations for business travel? This is an interesting one. When I talked to clients over the last year, mostly it was the folks who have to be at the office. How do we, or at the production facility or manufacturing line, how do we support them? now business travel has started returning, but what are your recommendations, Dr. Kusti, for business travel as it relates to staying safe?
Right. So this is a very good question. We're actually working on a lot of travel policies right now. First of all, we want to identify what travel is. So you're talking about domestic or international. And then with the domestic, we're talking about plane, bus, trains. So in your policy, you need to clearly define the method of transportation. The second thing is we want to avoid unnecessary traveling. So unless it's absolutely necessary for business or it's a business necessity, then they should not travel, because the CDC, WHO still considers traveling as a high-risk activity. And that's because of all the potential exposures before and after and during the trip. What some clients are doing, because these business trips are not an essential job function and they're technically voluntary, that means it's not a condition of employment, they're mandating the vaccines for people who wants to go on a business trip, because they are choosing to do the business trip as an option. Their job, they can do it through remotely, but they're opting to do this trip. And therefore, if they're opting to do this trip, they have to follow all the protocols, including getting vaccinated. So they're using that as also an incentive to have people get vaccinated. Very similar to what we did in international traveling. Like if you're going to a place where malaria is very, very common, then you don't go unless you get all the malaria prophylaxis. If you're going to a country that has meningitis, you have to get the meningitis vaccine. If you're going to a country that has yellow fever, you have to get the yellow fever vaccine, and so forth. So we're treating it just like we're treating other vaccination. And if they cannot get it or choose not to get it, then they don't go. And it does not impact their employment situation. And that was, obviously you need to discuss this more with your HR and legal folks, but that's kind of the discussion that we're talking about. In addition to that, a lot of companies are offering different options for testing before and after travel. So COVID testing, now there's a lot of in-home COVID testing that they can do. They can do daily rapid tests for several days before and after, and then self-quarantine or self-isolate after returning from the business trip, and therefore mitigating the risk of any kind of workplace outbreak.
That's helpful, and it's been useful as we think about that too. I think we've got 2 minutes left, so we'll just hit one question because I like where this one is looking. Employers have always played a role in health and well-being. COVID has been a place where that role has been outsized, I think. But the question from Zoe is, how can we incorporate what we're learning from this experience into longer-term workforce health or wellness strategies, prepare for the future? So maybe Dr. Kusti, I'll let you close this out with 60 seconds of that.
Yeah, I mean, this pandemic showed us how vulnerable our workforce is and how easily one virus came and took our business completely out of operation because our workforce was not healthy. And all the typical things that me as a corporate medical director have been endorsing wellness programs for controlling diabetes, tobacco cessation, weight management. We saw that all of these things that we've been trying to control all these years were literally the risk factors. These are the high risk people that ended up having to leave the workforce and they couldn't come to work. So I think a good takeaway is that employers should start really considering these workforce wellness programs and try to keep their workforce healthy so that if and when we have another outbreak or pandemic, we don't have to send everybody home because they're high risk. So I think that's a good takeaway and it's a good question.
Excellent. Well, thank you all for participating today. I think and I hope that you've been left with an understanding of where we are in the vaccination effort across the country, what is left to do, and it's important in terms of vaccinating people for us to really end the pandemic phase of COVID-19, what you and we as employers and those that support employers can do, and then also with some information to combat the myths or the misinformation or the questions your employees might have. So I really appreciate your time. Dr. Kusti, thank you for joining us. And Michelle, I'll turn it back over to you.